Bill, why don't you go ahead and introduce our next guest for us?
Hey, it is a great honor, and I think last time I was on, Rob said, hey, we were talking about our quick response team and harm reduction activities, and Rob was like, hey, talking about quick response team, and Stephanie Stout is with us this morning, and she's kind of our program administrator director for that grant that we have been so successful in acquiring through the health department, but it plays hand in hand with one of our harm reduction grants and programs that we administer at the health department, but we can't do it all. So we're blessed that we have Stephanie, who is an employee of the Dave Report Center, but they put her out to loan for us for these grants to be able to work with them, because the work can't be done by itself, and the grants are very important for our community. So it's great having Stephanie on here this morning with us.
Bill, before Stephanie actually says anything, you mentioned grants. Are we talking about federal grants or state grants?
They are federal dollars.
Are they in jeopardy now?
Anytime you get federal dollars, they're in jeopardy right now with our current administration, because it's new. The administration, it's new, even though it's old in some aspects. But we're concerned when these grants come time for renewal, which is for this year, is right around September, October timeframe. We're concerned about what dollars are going to be there, and also what are some of the limitations that potential that come from the state level as well.
Okay, thank you.
Stephanie Stout in studio. Good to have you.
Good morning.
Well, welcome. It's been a little while since we've last seen
years.
you. Yeah, well, good to have you back here. Thanks so much for coming in. Let's talk about harm reduction first, because over the last couple of years, I know Senator Eric Tarr has not been a professed fan of harm reduction. Can you explain how harm reduction works in Berkeley County and why it's controversial in some areas of the state?
Well, I think it goes back to the lack of education of what the program actually provides. I mean, if we look at Kanawha County or Cabell County and their rise in hepatitis, HIV, even in our county, I mean, I have some statistics with me today, and the cost of treating those conditions is far exponentially worse than what it would be for us to prevent them.
And harm reduction helps prevent those in what manner?
So we have people that come in, and yes, they're receiving clean syringes so that they can use and not share syringes, which can cross-contaminate and cause infectious disease. But also because it serves as a doorway to get connected with people in recovery that can help assist with, that warm handoff to a program or an inpatient treatment program.
The controversy in some parts of the state from the representatives I've talked to, delegates and senators, Eric Tarr being one of those, say that in Berkeley County you might be doing a health department run one dirty needle for one clean needle exchange and tracking that, but in some parts of the state they're not. There's private enterprises that are just giving out needles and not worrying about bringing any back. Maybe the health department's not involved in coordinating as much as they should be in some counties, and they want some restrictions on this program, if that's the right word for it.
Well, from what I have seen at the legislative level, it's not restrictions, it's wiping it out. And what I can say to that is the places that are operating that aren't adhering to the rules through OFLAC, I mean, that needs to be dealt with. But for a lot of the health departments, we're adhering to what we've said we will do in our policies and procedures. We are conforming to what OFLAC wants us to do, which is truly what this has become over the past
who's
couple
OFLAC? What is that?
That's Office of Facility and Licensure and Certification. So they cover a lot of state administered programs such as this. They also cover like nursing homes.
Are they state or federal?
They're state.
They're state. Okay. Some of the other controversy involved in this program, and by the way, I remember doing an interview with Senator Capito 6-7 years ago, who came around to this idea. A lot of Republicans a while ago were totally against this.
Right. But
once they saw some of the stats you referred to, some have converted to believing in these harm reduction programs. But those who don't say by giving an addict a needle, all you're doing is helping them with their addiction.
Well, I can understand why people would think that, but these people are going to use drugs whether we give them needles or not. And that's the whole idea around harm reduction. It's just like a seatbelt in a car. We wear them because they protect us. Do we always need them? No. But for the syringe exchange, we're giving clean syringes so that the individuals that are using the drugs are not sharing their needles with other people. And not only that, but they're being able to dispose of them in a proper manner that keeps them off of our streets.
Which I don't see anywhere near as many on the streets as I used to maybe 10 years ago.
Right. I mean, and
Do you track that?
Yes. So, and if you look at our program right now, most programs operate within a 60 to 80% return rate. That means that for the syringes given out, that's how many are returned. We're operating at almost a 200% return rate because we are encouraging the people that come to our program to clean up their areas where they live, their neighborhoods. And it seems to be working because, I mean, that's a phenomenal percentage to have for returns. And we aren't hearing as much from law enforcement as far as needing to go clean up areas. Now, there are some encampments that we have had to go out and clean up after, but it has not been like it was, I'd say, 5 years ago, where there was a tremendous amount and a big risk for, individuals at the park, people walking on the street.
When you do the needle exchange, are you tracking the name of the person, or do they still stay anonymous? You're just doing, you brought me a needle, you get a needle.
So we have identifiers that we use, but it is completely anonymous. So it goes based off of their first, last name, initials, and their parents, and then their birth year, and whether they're male or female.
And once you've established this trust, this relationship, do you have a ballpark figure for what percentage of these folks eventually get into recovery and come out the other end well?
Well, as I've only been in this position for just a few months, what I can say is prior, when I was a peer in this program, I would say that there's probably a 20% rate of where people either they get referred to some kind of MAT services, or they decide they want to go to detox or inpatient.
Mm-hmm.
And Rob, I think you need to realize when people come to the health department for harm reduction services, they're not coming through the doors because they're thinking of starting an addiction. They're coming through the doors because they have an addiction.
Mm-hmm.
And that takes a lot of courage to walk through those doors, especially if you've never been there before, because you don't know what to expect, and you're putting a lot of trust into strangers. But they don't leave a stranger. So we're not necessarily enabling, but we're helping. And that's what our job is.
Bill?
Stephanie, the needle exchange, is that done only through the health department? I know there's other places you could dispose of old needles, such as the sheriff's office a couple of years ago anyway, and other places through the county. But to get needles, it's only through the health department?
Yes. Okay. Yes, and actually we take the returns that the sheriff's department has, whether that's because they've seized, something on a drug bust or community members dropping them off. We take those now.
Are there other places in the county to drop off old needles? For example, I had EpiPens for several years that I never used. I must have had a collection of 25 or 30 EpiPens that I wanted to get rid of. I had trouble getting rid of them.
Right. So one of the things that we have, at the health department and at the Recovery Resource Center, because we have a lot of people that will come there to return them, is we have safe ways to dispose of those. Okay. We have a fact sheet that's from the CDC that instructs you on how to do that and how to do it safely so that you can dispose of them.
Yeah. When we first started this discussion, I had not been familiar with the harm reduction program. I was trying to wrap it within the vaccination program and all the pushback we're having now for vaccination. Do you find any in the mind's eye of a lot of the individuals in the county, any association between the harm reduction program and the vaccination program?
Well, absolutely. We provide testing and vaccination for hepatitis A, B, and C, and other vaccinations as well. But our main goal is to encourage people to get tested every 6 months with us so they can come into the clinic and do that while they're there. We also have a doctor on site that can help with different things that they may need, whether that's a primary care physician or maybe they're sick and they need an antibiotic. So we really do have like this wraparound service for the individual coming in. And the biggest thing is we're building that rapport with them so that they will trust that when it's time for them to make a different decision, that we're going to be all hands on deck to help them with that.
So you're talking in large part with addicts, but the non-addicts, do you have a lot of those folks coming in to be tested on a regular basis?
So that would be a bill question because I only operate within the harm reduction program.
Okay.
We do. We have a large number of people that come to the health department for getting testing for sexually transmitted infections. Used to be called STDs, now they're STIs. So we have a large number of people that do come in for that, and it's one of the programs that we operate under the health department that we don't really receive any funding for. And people will come to the health department because they know the services that are being rendered are confidential. And many people don't want to go to their private care physicians because they don't, number one, they don't want it coming out on an insurance statement, or they're concerned about who's going to find out. So they come to the health department knowing that, hey, you're going to get one-on-one service from our public health nurses, and it is confidential.
That you mentioned funding a second ago, Bill. Where does the health department get the bulk of the funding? I assume some from the county, some from the Fed, perhaps, and some from the state, perhaps. Also Medicare. Where do they get the funding?
Well, for our clinical side, we do bill all major insurance companies. But as anybody that knows that bills insurance companies, it doesn't pay what it costs. So we do receive funding from the state based off of our census for the county. We do receive local funding for Berkeley Morgan. We receive it from the county commissions. In Berkeley County, we get it from the Board of Education, from the city of Martinsburg. And then we write lots of grants. And then certainly on our environmental side for the health department, everything pretty much they do is a fee-based, with the exception of doing complaints and things of that nature.
Bill Kearns, of course, co-hosting, but acting almost as a guest in this segment, along with Stephanie Stout. Yeah. In regards to the needles that you collect, what's the disposal process like for that, and does it cost you anything to dispose of the needles?
So we actually have an agreement with a disposal company that was done before I came on. We put them in safe containers, and once it gets to a certain weight, then we dispose of them. I don't really know the cost on that. Bill is also the finance guy.
It's not a cheap service, and we are at our county, based on the amount that we have, we're considered a medium generating facility. So we have a license for that to be able to collect, and then we have a company that will come and do pickups a couple times a month, and then the charge is based on the weight.
Do you have a number count? Do you track the number of needles you have out at any given time, or you're taking in?
Yes. So with each participant, we count how many they've returned, and we count how many we're giving them. We have a strict 1-for-1 rule right now, and what that looks like is, as I've said, we have a 200% return rate. So we're getting far more than what we actually are giving out, which is
Are you
phenomenal.
giving out like 100 a week, 1,000 a week? What's the number?
For a weekly basis, I would say anywhere between 150 to 200.
And I think that a lot of that, we have those bills going on down in Charleston right now, and mentioned Senator Tarr's bill to completely extinguish syringe access programs across the state completely. And then speaking last week with Delegate Hornby, who is a co-sponsor on a bill that is very similar in nature, but with an additional committee substitute that basically says, you know what, you can still do syringe access programs in the state, but it has to be associated with a local health department that's going to be following those rules and regulations of OFLAC.
Wouldn't that be a beneficial bill in that case?
It is. It is. Some health departments that do harm reduction programs aren't as well staffed and have as great of a relationship that we have with the Day Report Center to provide that staff, because at the health department level, I would not have enough trained staff to be able to do this program on our own, or if we did, it wouldn't be to the same level that we're doing it right now. So that's why we have a great partnership, but that's not the same in every county across our state.
Of the 55 counties, how many counties have a harm reduction program?
8.
8. That's all. Mm-hmm. Okay.
What do the other 47 counties do? Is there private company? Is there a private company operating it?
There are a few, yes.
Are there some that
and those are the
just
ones that are concerned that are not necessarily falling under the local health department's authority.
So Senator Tarr's bill, would that address the other 47, 48 counties, or is it primarily targeted toward Berkeley or all of them?
Well, since the bill only addresses syringe access programs, and there's only 8 that are doing that, it's just those.
Just those 8.
But the thing is, and they're not saying you can't have a harm reduction program within your county. Senator Tarr's bill just basically says no syringe access. So if you remove that part, you will essentially dismantle the harm reduction program.
What other part of harm reduction is there other than the needle exchange?
I think Stephanie talked about it very well, that we do STI testing, education. They provide Narcan to people that come through the doors. There's a lot of parts of that, but pretty much when people are coming through the door, as we mentioned, they are already addicted, and the part that they're sometimes looking for first is that syringe access.
Give me an idea what it looks like in Berkeley County without a needle exchange program, Stephanie.
Well, I would see a rise in the HIV cases that we currently have, a rise in hepatitis C. We already have a pretty good high number on that. I think it's 3.3 per 100,000 as far as mortality. The cost for most of our folks that possibly aren't working, they're on Medicaid or they're on Medicare, that's a strain on the state to be able to provide those services to treat these infectious diseases. So, I mean, the proof is in the pudding. The numbers make sense. If we're paying, say, $95,000 for somebody to receive treatment, that's insane. I mean, if we look at HIV, a lowball number for that is $1,800 a month. So for 10 years, an individual would $216,000 for 10 years. And if that's a person that's on Medicaid or Medicare, that's going to cost our state. So it goes back to the taxpayers. So if you think about one person taking that much out of our money for the state, and then you think about the cases that we've had as of 2022, we had 124 in our county living with HIV. So just look at the numbers and what the cost is. It makes sense to keep these programs active and working in our communities because it's going to reduce just that cost. And that's not counting any of the other, infectious diseases that we may have or other public health incomes that we're not measuring.
Sounds like at least Senator Tarr is not listening to the numbers. How much support are you getting from the state legislators as a whole?
Bill?
We have some that are listening to their health department subject matter experts, such as Delegate Hornby. He's been very available to, I know, Dr. McLaughlin and myself of late, talking about bills and how to craft them. A bill's crafted initially and then how to adapt it to the needs. But I think that's a rare commodity. So I'm not sure.
How about our state senators, our local senators?
As far as federal?
No, I'm talking about on the state level. I'm trying to someone that would counter Eric Tarr.
Well, I think on the Senate side, it's not been, I don't want to say we don't have any support. It's just not gotten to the level that it needed that support, if that makes sense.
Not really, but okay.
Wrong person to ask that too.
Well, and in the past, if you look at some of the bills that have come up that have been, targeted towards harm reduction, not all of them have made it through. We have a lot of people that are working these programs that go down there and talk to their senators. We've written letters to our senators and make sure that, the respective people representing us know why it is so imperative to keep these programs.
Stephanie, thanks so much for coming in.
Thank you.
Let's not make it 7 years next time.
Right?
Right? And congratulations on your new position.
Thank you.
I'll be back with a final minute right after this.